It's funny, I mean, I'm a specialist in breast surgery. Plastic surgeon. I did a fellowship in cosmetic breast and body surgery. My title of my business is North Texas Breast and Plastic Surgery.
Yes.
I do breast surgeries multiple times a week. So I always find it funny or odd when I see an article about plastic surgery and it's talking about some breast surgery thing that I've never heard of.
Yeah.
I mean, I constantly am doing research for the show. I like to keep up to speed on everything. And with all that experience and knowledge, I still will find things. I'm like, what is this? So that happened to me this past week. Today we're going to talk about what is designer breast surgery. Have either of you guys heard of designer breast surgery?
No.
Never.
Trey, tell me about designer breast surgery. Any idea?
I could not tell you.
Okay, all right. I had no idea what this meant either. So I found an article. Throw up that article in case anybody wants to look at it. It's not great. I'm just going to let you know. So what does the term designer breast surgery really mean? All right, that just came out.
It's not good.
Well, I kind of figured I knew what they were going to say, but let's see what they say. So the article defined designer breast surgery as a highly customized approach that many surgeons now bring to their work, aiming to create results that feel uniquely tailored to each patient.
Well, if the doctor's not doing that, then they ain't doing their job.
Sarah, you could have absolutely done this segment. You're 100% correct. So in the article, it actually quoted a plastic surgeon I know, Dr. Calabrese. He elaborates. This begins by focusing on the patient's anatomy, frame, and personal goals rather than a standard approach. Yeah, this article is just kind of dumb. I mean, I just don't even know how to say it. Like, Sarah, you absolutely just hit this on the head, that what they're talking about is literally what
Doctors are
every
supposed to do.
plastic surgeon should do for every single patient. However, I will, in their defense to a certain degree, say that I do see patients that get in with some plastic surgeons and it's almost kind of like a
Factory.
Like
Yeah.
everyone gets the same thing. It happens. And what ends up happening is the patient gets something they don't want.
Yeah.
And that's bad. But I'm not sure that we need to call the right thing a special word like designer breast surgery. This is a marketing gimmick for sure.
Yeah.
I mean, you're right. It describes a technique that literally everyone should use, and although it doesn't happen. So what can we learn here from this article? Well, I think that the one thing I could probably help people out is to tell you what would include in a good consult. Because if you don't get a good consult, I do think that you should, at the very least, get a second opinion, if not just completely turn away from the surgeon that you went to.
Yeah.
This is a service industry, right? You're not going to get a breast lift or breast
For
aug.
your medical health.
Yeah, for your medical health. So
For fun.
take your time and find someone who is going to give you the best chance of a good outcome.
Yeah.
So, I think kind of like the big takeaways from getting a consult for breast surgery, whether it be aug, lift, or whatever, is to find someone that is going to spend the time to make sure that you and the doctor are on the same page and that your expectations are for sure going to get met. Mm-hmm. And so when I do these consults, man, I don't blow through them. A fresh consult for me is easily 30 or 40 minutes.
Yeah.
Between describing the procedures, doing the exams, showing pictures and whatnot. So with breast surgery, when people come in, I have questions I want to ask. So number one, what are you trying to accomplish here? What's the goal? And sometimes patients can tell me very specifically. They're like, I want it to be bigger. I want it to be fuller, so on and so forth. And sometimes patients don't know.
Yeah.
They don't know. They just know they don't like it, but they don't know exactly what they want to do to get it better.
I don't like this. Fix it.
Yeah, right. I have people literally say that. And so at that point, that's where the surgeon's got to step up and spend the time to see exactly what it is. So other questions I ask are, do you want to be fuller, right? Do you want to be bigger? Do you want to improve the shape? And so when I ask those questions, and the other thing I also ask is, do you have a specific look that you want? And so a specific look, some people come in, they say I want the stripper boobs. I literally have people tell me that. Or they'll literally say, I want the porn star boobs. And I know exactly what they mean. I mean, everybody knows what that is. Or they'll say, I don't want something I want completely natural. Or I want something that's proportionate. And I'll say, did you bring any pictures in? Pictures are helpful. I think
I was the unprepared one.
Oh, were you?
I went to mine.
Did your surgeon do you right, though, and spend time with you?
Yeah. I mean, I had
Pretty
one
good.
consultation.
You did, but you didn't,
But to me, I didn't really know what I wanted. I just knew that
You just
I
want
just-
something different.
I
Yeah.
wanted to be bigger, but I
Okay.
also didn't want to look like weird.
Okay. I mean, that's helpful. That's
I
at
wanted
least
it
a
to
start.
like, I
That's
wanted it to look normal, like on a person my size.
Yeah.
I didn't want it to look weird.
Yeah.
Yeah.
Right. Okay. Yeah, so you ask all these questions, and what you're basically trying to get at is, okay, what procedure does this patient need, and how exactly are you going to do it? So, kind of the 3 procedures, that mostly we're talking about here is breast lift, which improves shape and increases fullness, breast implant, which improves fullness and increases size, or a combo of both, a lift and implants, which will improve the shape, increase the size, and increase the fullness. And I think it's important to dive into that because I have a lot of people come in and want a breast augmentation consult, and come to find out they just really need a lift. Like they have breast tissue, but it's just not where it's supposed to be, and they don't have a full upper pole, and so they don't like the way they look in bathing suits and dresses. And all they really need is a lift.
Yeah.
But if the surgeon doesn't take the time, or maybe they have their nurse doing the consult, like that patient will get set up for an augmentation and get that, and then be upset because now they're much bigger than they wanted to be. They may be full, but now they're much bigger.
Yeah.
Right. And then they're unhappy, and they're coming to me in a year or two, and like, I don't want that. I have that happen all the time, so many times. So I guess, to this article's defense, yes, this article should have been titled, "Make sure your surgeon does a proper consult." Like that's
these are
what
the things to
This is
look
what
for.
this is what normal should be. So yeah, I go through all that with the patient. I talk about different implants. So I have a standard implant I use most of the time, but if people have very specific requests, then I will dive into, okay, would maybe one of the specialty implants be better for you? I use a sizing system if we're doing an augmentation consult. So I put them in a bra, and I have these little special gel inserts that go in. And so they can literally put these inserts in until they get to the size that they want. And
I
then
think I remember that.
did they do that for you? I think we actually talked about that at one point. Yeah, that's great. I love that. It works very well.
You let
'cause
me feel what a saline one feels like, and
Yeah.
like silicone.
nowadays, we don't have the saline. We used to have the saline, so we don't have them in the office anymore because they're just not used. But yeah, the sizing system works great to make sure that when you get on the other side of this, that you're going to get exactly what you want. But yeah, I mean, the bottom line of this is that if you were going to have plastic surgery, whether it be breast surgery or anything, it is a surgeon's obligation to listen to you and make sure that you guys are on the same page so that there's no surprise in outcome and you're going to get what you want. And if you don't feel like that happened 100%, you should absolutely go to a different surgeon. I don't like when plastic surgeons like have their nurse explain the procedure and then the surgeon just rushes in and looks at you and be like, okay, we'll see you next Friday. I mean, you're much more likely to get, and I worked with people like that. I remember when I was in training, and I've worked with a lot of people, and some people did a really good job, and I was like, okay, I feel good about this. And other times it was like that, where they just rushed in and rushed out. I'm like, yeah, I don't like this. Like, this is not how I'm going to do things. So, designer breast surgery, I mean, that's just a marketing gimmick. That's not the take home here. Any good plastic surgeon is going to give what this article is calling designer breast surgery. It just means they're going to listen to you. They're going to tailor a plan for you. They're not going to do some cookie cutter operation.
Like at those little plastic surgery mill.
The plastic
places.
surgery mill. Yeah, that probably does happen a lot there. Like where people just get kind of a one size fits all
Yeah.
treatment.
Like
Or it's
I'm
like
an
the-
A, and they're like, okay, so you want to be a D.
Yeah,
Bye,
you want
next.
to be yeah, next. Ding.
Yeah.
Yeah.
See ya.
Now serving number 43. Yeah.
Yeah.
Yeah. So I think there is something to learn from this. I didn't like the article. I thought it was just fluff, but I like at least what they're trying to do, which is to make sure.
They're trying to make it sound more sexy instead of saying like, this is just a
Well,
good breast augmentation.
Yeah, I guarantee
not
what
saying
happened
designer.
is, one of these people that they quoted in this article like made up this term designer breast surgery, and they're pushing it. It's like, oh, I do designer breast surgery, right? And people like, if you're a consumer, you're like, geez, that sounds pretty good.
That
actually,
sounds like something I want to
that
buy.
sound. I would want like a designer, whatever it is I'm buying. Like I want the designer chainsaw or
The chainsaw.
whatever. Right? It just sounds like it's.
Those are definitely made in a factory.
Yeah, it's definitely. I want the hand assembled chainsaw or whatever. No, but it makes it sound better. But the thing is, it should be like that no matter what. That whole thing that described should be
Definitely.
an interesting statement. So, all right. I think that we've probably beaten these topics to death for today. I think that probably we're gonna like move on to like the next week.
Yes.
Yeah. So, all right. Let me know what you thought about this episode. leave me some comments. If you leave us comments or questions about things you want us to talk about, I promise you we will talk about them. So leave it on social media if you see it there or on the YouTube channel. Thank you guys so much for tuning in, and we will see you next week.